Hello, everyone. Thank you so much for joining me today. My name is Jocelyn Donovan. I'm the CPNP for Niwasa Kindaswan Teg. Today, I'm going to talk to you about some aches, pains, and complaints that you may experience during pregnancy. I realize that this segment might get a little depressing and might create some new anxieties. I want to reassure you that a lot of the conditions I'm talking about are pretty rare and some of them are a bit more common. But it's not something that you should worry about. It's just information that you should have if any of these conditions do occur. Pregnancy is a beautiful thing. You are growing a life inside of you, and you're going to experience more love than you ever thought possible. But unfortunately, pregnancy can also be extremely difficult on your body and your mental health. Some of us get really sick while bringing new life into the world, and for those people, I commend you. It's not easy being a miserable pregnant lady when everyone wants you to be glowing and full of life and happiness. So this one's for you. A depressing lesson about some of the worst parts of pregnancy. You may have heard the term preeclampsia or maternal hypertension, but what does it mean? Preeclampsia is a disorder that can occur during pregnancy that affects both the mother and the baby. Roughly 1 in 200 women in Canada will experience preeclampsia during their pregnancy. Your doctor or midwife can diagnose preeclampsia by measuring your blood pressure and your urine for proteins. During my first pregnancy, I was given like a pee cup and a little strip every time I went for an appointment, and you would pee in the cup, dip the strip, and if the strip turned green, then that would indicate that there were some proteins in your urine. But for my second pregnancy 2 years ago, they actually stopped that practice. I don't know if it was too expensive or if it was causing anxiety, but regardless, they didn't do it anymore when I was pregnant the second time. So instead, they just said that if you have any of these symptoms, if we're concerned about you having preeclampsia, then we'll do the urine test. If you have preeclampsia, you may experience swelling, especially in hands, wrists, ankles, and feet, a sudden weight gain, very blurred vision, and headaches. Typically, preeclampsia occurs in the last 2 trimesters of your pregnancy, and people with diabetes are at a higher risk of developing preeclampsia. You can try to prevent preeclampsia by monitoring your caffeine and salt intake, but there's no guarantees. Sometimes it just happens. Anyone can develop preeclampsia, which is why it's important to go to your prenatal appointments and monitor your symptoms at home. Preeclampsia can lead to fetal growth restriction and a low birth weight, preterm birth, placental abruption, where your placenta can separate from the inner wall of the uterus before delivery, and eclampsia, which are seizures. It can also damage your other organs. Next, I'm going to talk about abdominal separation. As many as 60% of women experience abdominal separation or diastasis recti during and after their pregnancies. As your baby is growing, it pushes your uterus against your abdominal muscles, making them longer and weaker. Usually this separation disappears by the time your baby is 8 weeks old and your stomach muscles will be back to where they belong. However, for some women, they remain separated, which can be very painful. You can help prevent this condition by doing pelvic floor exercises, also known as Kegels, and abdominal exercises before and after pregnancy. Also, engaging in low intensity exercise during your pregnancy can help prevent this condition. Post-pregnancy, you can visit a physiotherapist to help repair the muscles, but for some women, a diastasis recti repair or tummy tuck is needed to correct the condition. Remember, your body is going to look different after having a baby grow inside of it, and you should feel honored that your body was able to bring new life into the world. Don't compare yourself to Instagram influencers or the super fit friends you have on Facebook or celebrities, because most of us don't look exactly the same after childbirth, and that's good, because we shouldn't all look like we're 19 years old. We should look like women who have brought life into the world. My next topic is constipation and hemorrhoids. You may have noticed that you are experiencing some constipation since becoming pregnant. This is very common. That's because your body is taking longer to digest food so it can absorb all of those nutrients for your baby. You may also become constipated if you're taking iron supplements. Luckily, there are a few things you can do at home to help ease constipation. You can drink lots of fluids. Remember, you're meant to drink at least 2 liters of water a day, and warm liquids like tea can help ease constipation. Also, eating lots of fruits, vegetables, whole grains, and beans can help as well. Being active and engaging in low-intensity exercise is also known to help prevent constipation. Essentially, the healthier you are, the healthier your body will be. Do not use laxatives, enemas, or rectal suppositories for combating constipation during pregnancy unless directed by a doctor or your midwife, as these can bring on labor contractions. Here's an embarrassing story. So when I was pregnant with my first daughter, I had a craving for dried apricots. Weird craving, I guess, but it's something that I ate a lot as a child, and I couldn't stop thinking about dried apricots. So I went to the store and I got myself like a big bag, and dried fruit's expensive, eh? Anyway, I went home, I watched TV, and I was munching on my bag of dried apricots. Probably had like a good pound of dried fruit. And then I had to run to the bathroom because I didn't realize that dried apricots are actually used as a laxative. So after sitting on the toilet for a long time, I started getting labor contractions. And I was pretty worried because I was only about 30 weeks pregnant. So I got on the phone with my midwife and had to explain to her why I had diarrhea and contractions. And then she sent me to the hospital where I had to explain to like 10 more people why I had diarrhea and contractions. And they put me on an IV for about an hour. I got more fluids, the contractions stopped, and I was fine. But yeah, it was pretty embarrassing. You lose a lot of your bodily shame when you're pregnant. You get used to people kind of poking and prodding around where no one had ever poked or prodded before. But that was pretty embarrassing. I'll remember that one for a long time. Speaking of bum problems, next we're going to talk about hemorrhoids. Now, if you're squeamish about the human body, you may want to skip over to the next minute or so because this might get a little graphic. Hemorrhoids, also known as the worst spelt word in the human language, are veins in your colon and anus that can become swollen and inflamed. They can swell so much inside your colon and anus that they start to bleed and can really hurt during a bowel movement. They can also protrude out of your anus and bleed. If you notice fresh red blood when you wipe your bum, you probably have swollen hemorrhoids. They are especially common after giving birth vaginally. All the pushing and pressure can cause your hemorrhoids to flare up. For most women, hemorrhoids will calm down by 4 weeks postpartum. Hemorrhoids are treatable with suppositories. Check with your doctor before taking any kind of medication while pregnant, but hemorrhoid cream is not considered a risky medication, and you can definitely take it post-pregnancy. Next, I'm going to talk about varicose veins. The term varicose veins refers to a condition where superficial veins that are not required for survival, become enlarged and twisted. This occurs most commonly in your legs during pregnancy. It's actually essentially the same as hemorrhoids. When a vein in your colon becomes enlarged and inflamed, it's a hemorrhoid. When it's in your leg, it's a varicose vein. They develop most commonly in the second half of your pregnancy when you have all that extra weight weighing you down and putting pressure on your legs. Your doctor can diagnose them from sight or with an ultrasound. Many people conflate varicose veins with spider veins, but they're not exactly the same. Spider veins are more superficial and they shouldn't cause you the same kind of discomfort as varicose veins. If you have varicose veins, you may have noticed aching and swollen ankles in the affected leg. You may have a brownish, yellowish, shiny skin discoloration near the affected vein. You can also get muscle cramps and white scar-like formations and bumps under your skin and burning or throbbing in the leg. Typically, symptoms are mild in pregnant women. However, in some cases, the pain, skin discoloration, skin ulcers, and severe bleeding after an injury can seriously impact an individual's quality of life. If you have varicose veins, you can treat them at home by elevating your legs, wearing compression stockings, and taking anti-inflammatory medication like ibuprofen. However, during pregnancy, you cannot take ibuprofen or Advil. If your varicose veins are not responding to at-home treatments, you can talk to your doctor about surgery or other medical interventions. Next up, bladder weakness. You've probably heard older women joking or complaining about peeing when they sneeze or cough or not being able to hold their bladder so well anymore. They're not wrong. Pregnancy and childbirth will affect your bladder and your urethra, the tube inside your body leading to your bladder. You may have noticed already that you can't hold your pee as well as you used to. It may feel like you're in kindergarten again, running to the bathroom. This is completely normal and mostly due to hormones and the baby sitting on your bladder. However, this problem may not disappear after delivery. Especially if you deliver vaginally, you may injure the muscles that control your urethra, causing bladder weakness or urinary incontinence. Now, I want to clear up a common myth. You do not pee out of your vagina. Let's go back to health class. This is a diagram of what is commonly referred to as a vagina. There is the clitoris, labia, vaginal opening, and right here in the middle is the urethra. That's the tube that connects to the bladder, and that is where you pee from. You may have noticed it is very close to the vaginal opening, where the baby will come through during vaginal delivery. If you find that after pregnancy you're still having trouble controlling your bladder, there are a few things you can do to help. You can do Pilates or any exercise that strengthens your core and your pelvic floor muscles, like Kegels. You can also stop smoking, as excessive coughing can weaken your pelvic floor muscles. If you are overweight or obese, losing weight can help with incontinence as well. Constipation can also strain your pelvic floor muscles. So remember the tips earlier for relieving constipation? That should also help with urinary incontinence. You can also cut down caffeine, alcohol, spicy food, and acidic food, as they can also irritate your bladder and make the symptoms of incontinence worse. But of course, talk to your doctor and figure out the best plan for you and your body. I hope that none of you experience these conditions, but if you do, they are all treatable and rarely result in long-term damage or pain. Pregnancy is beautiful, but it's also scary and life-changing. But I promise, it is worth it. I had terrible pregnancies. I was horribly sick the whole time, and I still wouldn't change it for anything because my girls are worth it. No question. Thanks again for joining me. I hope you learned something. Please let me know in the comments how your pregnancy is going, if there are any topics you would like me to discuss. Thank you. and goodbye.